My name's Louisa Pico and I was a PhD student and I'm now a research fellow at the Monash Addiction Research Centre, which is part of the Eastern Health Clinical School at Monash University. I first got exposed to research when I was doing my Masters of Public Health. One thing I love about the research that I do is I get to work with consumers and people with lived or living experience, and really involving them in our research and having their inputs helps to ensure that the end product that our research is aligned with their needs and their voices are being heard at all stages throughout our research. The name of my project is Addressing a Global Public Health Crisis, a multifaceted approach to addressing opioid-related harms. In Australia, we have one of the highest rates of opioid prescribing per capita in the world. And so I guess my research and the research of our team is really about adopting a multifaceted and evidence-based program of research that tries to look at the impacts of opioid policies while informing clinical practice and also, promoting harm reduction approaches and strategies. We've looked at, as I said, a broad range of aspects in terms of reducing opioid-related harms. We've looked at the impacts of opioid policies which have been introduced in Australia, so in particular prescription drug monitoring programs. And these are online databases that track prescribing and dispensing of high-risk medicines like opioids, and they really help inform clinical decision-making. Since launching the toolkit in August of last year, we've seen really positive uptake with over 60,000 people accessing the toolkit to date. Seeing the toolkit materialise into a useful resource that's being used by so many people already is really pleasing to see, and it really demonstrates how research can make a difference to people's lives.